Now, the Government Employees Medical Scheme has held a symposium addressing fraud, waste and abuse in the healthcare sector. It was held under the theme Fraud, Waste and Abuse in Context. And just how bad is the situation in the health sector? Let's discuss this further with GEM's Principal Officer, Dr. Stanley Moloabi. Thank you very much for your time, Doctor. And let me start with that very question. How bad is the situation? What came out of the symposium that is of greatest concern within the sector?
Good evening, Rafiwa, and good evening to the viewers of eNCA. How bad is the situation? It is not something that is happening now. We know that fraud, waste and abuse have existed, in the medical aid industry for some time. And this is one of the things that led to, the Section 59 inquiry. However, in terms of the estimates that we have, and these are estimates because we do not have studies, that indicate exactly how big the problem is. So we're really basing our everything on estimates. So it is estimated that anything between 5 to 15% of claims that are paid by the industry could be fraudulent claims, and I'm stressing it is an estimate. So if you calculate that 5 to 15%, you may just take the middle as 10% of the industry. The industry covers about 9 million beneficiaries out of the 60,000 population, 60 million population in South Africa. So, and it is worth about 200 billion, just to round it off. That would be anywhere in the region. The fraud then would be, based on those estimates, around 20 billion.
I mean,
so that's the extent.
Yeah, what does that say about oversight within the medical industry and creating mechanisms to make sure that things of this nature do not happen? Surely there was a gross lack of oversight that has been allowed to grow over the years.
No, it isn't a lack of oversight. It is the complexity of how the system operates. So the opportunity for fraud, waste and abuse is as a result of a third-party payment system. And what do I mean by that? If you need to buy, and to simplify it, a loaf of bread, you walk into a retail store, you indicate you need a loaf of bread, you pay, and then you walk out with the product. In the medical aid industry, when you need the product health, you go to a service provider, it could be any across the value chain, and then you basically consult, the services rendered, but you don't pay. A third party, which is the medical scheme, pays, and that's the complexity. That is what creates the opportunity. So then what then happens is that you don't actually know how much you've paid, and that's just to simplify it. So what has happened over the years is that systems have been put in place to basically manage fraud and mitigate this fraud that we may be experiencing. However, when there's an opportunity, the human nature is that people take care of this opportunity. And the result, as you know, has also been controversies around how healthcare providers are treated when there are investigations. There are systems in place, and there's also a posture to work against fraud. However, it does happen, unfortunately, because of how complex the system is.
Doctor, I'm going to challenge you there. You're telling me that it's not a lack of oversight and it's the complexity of the system. Surely, when you recognize that the third-party system is not working and it's creating the opportunity, as you've just mentioned, for some people to take advantage of this complex system, you have to admit that there is some lack of oversight in terms of monitoring the system and ensuring that if it's something that's not working, it gets changed.
Well, there has been an investigation into how fraud is being managed by the industry. And this was as a result of allegations that in doing so, in managing the fraud, certain sectors of society, and particularly black health professionals, are being not treated. I'm sure you will remember the outcome of the interim report, which was a matter of public discourse. So there are systems. There's a lot of work that is being done to combat fraud. However, because of the way what I've just explained, in doing so, there are also certain consequences that have resulted in people being unhappy. When fraud happens, when it is identified, steps are taken, there are recoveries, and in some cases, those who have been found to have committed fraud are reported to the relevant authorities, whether it be the regulator or whether it be the police, for instance. These things are being done. However, because it has become so emotive, that's why I talk about complexity, and that is why it had to be investigated. And part of what we shared today in the webinar was the interim reports, the findings of the interim reports, and what we at GEMS have done to look into the recommendations. We are still awaiting the final report. So there's a lot of work that is being done. So certainly we cannot say there isn't oversight. There's a lot of work that is being done to combat fraud.